From coast to coast, our nation is being challenged by an epidemic of huge magnitude. That epidemic is opioid use disorder, causing a rise in deaths and negative economic impact. Overall, 2/3 of all drug overdoses in the United States are attributed to opioids, with more than 68% of those deaths occurring among males. The loss of life from drug overdose deaths involving opioids alone rose from 18,500 deaths in 2007 to nearly 47,000 deaths in 2018. In Missouri, opioids were involved in over 1,132 deaths in 2018. In addition, opioid use disorder costs exceeded $14 billion, with overdose deaths accounting for 93% of that cost. A common concern among practitioners is the current pandemic and the isolation and emotional uncertainty COVID-19 may generate. That threatens to lead persons to misuse medications as a way to cope with mental health issues. That's why in communities across the Ozarks, there is an urgency to continue addressing this epidemic within the context of the COVID-19 pandemic. Throughout the past year, CPO has continued to address medication misuse from a preventative standpoint through the expansion of Generation Rx, a program which began as a collaboration between Ohio State University and Cardinal Health Foundation. It was formatted to be applicable for audiences of all ages, from grade schoolers to older adults, and teaches individuals how to safely use, store, and dispose of medications. This program proves necessary as year after year, the leading cause of accidental death, according to the Centers for Disease Control, is unintentional overdose, particularly involving prescription medications. Here in the Ozarks, the State Opioid Response Grant funding has been used to facilitate Generation Rx. Prevention Resource Center staff at CPO, along with students in the UMKC School of Pharmacy at MSU and Evangel University social work programs, have worked to bring the evidence-based medication safety education to thousands of community members in Southwest Missouri. With a 3-year commitment to address this crisis, CPO set a reasonable goal to reach 250 people a year for a total of 750. Instead, we have reached 7,369 individuals, greatly exceeding that original goal. Through the incredible efforts of staff and partners, we have trained 193 persons to facilitate the Generation Rx program, providing medication safety education to 2,222 youth this past year. Evaluation results were positive, with 93% of youth reporting awareness of the prevalence of medication misuse among teens and 80% awareness of potential consequences of misuse. While our staff has been challenged by restrictions regarding in-person presentations like Generation Rx, they have adapted the project to accommodate these limitations and have recorded video presentations to share virtually on our organization's website, cpozarks.org/opioid prevention. We are certain there is more work to be done in regard to the opioid crisis, and we are excited to announce the State Opioid Response Grant has been extended. This will allow CPO and our partnering agencies and the communities we serve to continue finding innovative ways to present Generation Rx and other life-saving prevention tactics to reduce the misuse of medications and ultimately the loss of life attributed to unintentional drug overdose.